Support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum. Located in Jennings City Hall, the museum focuses on emerging Louisiana artists and is a historical and cultural center for Southwest Louisiana. Additional support provided by the Foundation for Excellence in Louisiana Public Broadcasting and viewers like you.
Tourism is big business, Andre.
Staying big could hinge on the passage of a tax that Baton Rouge voters don't have to pay.
All the girls, they love me, 'cause I know my way around. It was long, 1949.
1949 was about the time Fats Domino took off as a music legend, and his legend never dimmed. Hi everyone, I'm Andre Morrow. In a moment, a look back on the life of Fats Domino and the banquet of musical riches he gave us. Plus, tourism leaders across the state sound off on a hotel tax they say is essential to do their job. But right now, on the state we're in, some other stories making headlines. Because Louisiana is one of 20 states with a significant increase in opioid deaths, Governor John Bel Edwards is particularly elated about an announcement made this week by President Trump. The president's declaration that the opioid crisis is a national public health emergency. Trump may also file a lawsuit against opioid manufacturers for their role in escalating the national crisis. In September, Governor Edwards and the Louisiana Department of Health filed a similar lawsuit. The governor and Dr. Rebecca Gee, Secretary of LDH, were at the White House when the announcement came. The governor delivered fairly good news about the jobs numbers released by the State Workforce Commission for September 2017. The latest report found Louisiana's unemployment rate decreased for a fifth consecutive month to 5.1%. Since Edwards took office in January 2016, the unemployment rate has dropped from 6.2% to 5.1%. 6 years after the Mississippi-based Hancock Holding Company bought Whitney National Bank, the most prestigious bank brand in New Orleans, comes another announcement. Beginning next year, all bank branches will be called Hancock Whitney Corporation. The company had operated as Whitney Bank in Louisiana and Texas and Hancock Bank in Mississippi, Alabama, and Florida since Hancock took over Whitney in 2011. Another big name change will impact Louisiana's tallest building, the former One Shell Square. It will become the Hancock Whitney Center in 2018. Steelmaker Nucor restarted its Convent Mill October 3rd after stopping production in late July. The company says Nucor is once again producing high-quality direct reduced iron. Nucor's third quarter earnings were off compared to the same time a year ago, and the primary reason, according to the company, was the unplanned outages. Nucor's raw materials segment earnings before income taxes and non-controlling interests dropped 31% to $10 million for the quarter. Thumbtack awarded Louisiana a grade of A+ in its 2017 report card on small business friendliness. It gave the state a ranking of number 4 in the U.S. for its supportive small business environment. The state earned an A in 8 specific categories of the state's small business climate and a grade of B in 4 other categories. Louisiana is toughening its rating system for public schools, a move that has divided the education community. The worry is that it will dramatically increase the number of schools deemed failing. Under the new rating system, the number of F-rated public schools is expected to shoot up 57% next year, according to the Advocate newspaper. Those with A ratings are expected to drop 38%. The new rating system won approval from the State Board of Elementary and Secondary Education. This week, Louisiana celebrity chef John Besh left his company, the Besh Restaurant Group, after it was revealed that 25 women, all current and former employees, said they were victims of sexual harassment while working there. An investigation by the Times-Picayune and NOLA.com revealed the culture of the Besh Group was permissive of harassment. Besh is a James Beard winner, and he owns several restaurants. Next month, EBR voters can say yes to a tax that they won't ever have impact their bottom line. It's a vote tourism leaders from across the state are watching carefully. From social media campaigns to yard signs and soon-to-be radio commercials and electronic billboards, the run-up for the tax you don't have to pay is light years ahead of the promotion done last year for the increase of a hotel occupancy tax. The promotion in 2016 was almost non-existent, and the tax plan failed. It seems always tax-weary voters never got the message that they wouldn't be paying for it.
An occupancy tax is what is paid by a visitor to a hotel on a hotel room. I like to think of it as the total tax paid on a hotel room occupied by a visitor.
Paul Arrigo heads up Visit Baton Rouge, which promotes Baton Rouge to the rest of the world. A hotel occupancy tax, used universally, is the lifeblood for the people entrusted with attracting people to the city or place they promote, like Visit Baton Rouge. Their work is to get people who don't live here to decide Baton Rouge is the place to be, to come and enjoy what the city has to offer, and to spend money.
Tourism is big business, Andre.
Jill Kidder heads up LTPA, the Louisiana Travel Promotion Association.
If we don't have the fuel to put in the tank, and that's what this money is, to market our destinations, then we're not able to do our jobs, and that car doesn't run any longer.
Arrigo says with the proper money to do the job right, the entire state wins. But in the past year or so, things have been tight in Baton Rouge. The successful Bayou Country Superfest was forced to leave, all because of renovations being done at Tiger Stadium, the giant Superfest venue. Derogatory comments about immigrants made by then Miss USA pageant czar Donald Trump hastened the exit of the national pageant after a glistening 2-year run at the River Center. The flap over Trump caused sponsors to back out, temporarily put the pageant in limbo and out of Baton Rouge.
When a visitor comes to Baton Rouge, they spend time in Baton Rouge, but they spend time throughout the whole state. The state benefits. Sometimes when a person comes to Baton Rouge, they go on to Lafayette, New Orleans, even up to North Louisiana. But that money stays in the state, and it's good for the economy.
The capital city's hotel tax is now 14%. Experts say 16% puts it in line with where it needs to be. There are state and local taxes of 10%, and the remaining percentage is shared with the Raising Cane's River Center. The River Center is about to undergo a major facelift. If the Baton Rouge hotel tax moves to 16%, it would still be a bargain next to 3 comparable cities. Birmingham's is at 17.5%, Knoxville, Tennessee is 17.25%, and Mobile 17%. Though Metro Baton Rouge is twice the size of Lafayette, it does not have the flow of tourists.
In our area, known as Acadiana, we like to say we're the second most visited area outside of New Orleans in our entire region.
Ben Berthelot is CEO of the Lafayette Convention and Visitors Commission.
For us in Lafayette Parish, it's about 98% of our total budget, which allows us to go out and market our community and attract leisure travelers, group business, and meetings and conventions to our area.
A Restaurant Association Political Action Committee is spearheading the push for the hotel tax increase. Visit Baton Rouge is legally prohibited from campaigning for the tax, but it sure shows you the tight network of hotels, restaurants, and businesses that want visitors.
We work in partnership with those organizations. We work very closely with the Office of Tourism at the state level, and also the Lieutenant Governor's Office, who is, of course, in charge of tourism for the state of Louisiana. And then we work and actually manage the Louisiana Association of Convention and Visitors Bureaus throughout the state.
If you still want to know more about this issue, check out their Facebook page. It's at Hotel Occupancy Tax Proposition. Well, it seems like a lot of prisoners, about 1,500 offenders of nonviolent crimes, are set to get out of prison early starting November 1st. LPB's Kelly Spires is here with that story. Kelly?
That's right. That's all part of the criminal justice reform measures the legislature passed in the spring. We sat down with Elaine Ellerby. She's the state director of the conservative group Right on Crime. They support the measures. So for those who aren't familiar with the criminal justice package that passed in the spring, seeing the number that about 1,600 people are about to get out of prison might be a little shocking. Can you tell me why they're getting out and what makes it safe for communities?
So what has happened now is one of the pieces of legislation that passed, it is taking the good time that people can accrue from 35% to 40%. So in effect, what you're seeing is that people that may have had a 10-year sentence, they may be getting an additional 60 days, 90 days off of their sentence to come out. This was specific legislation that earmarked this type of good time for nonviolent, non-sex offenders. And the other thing we have to realize, when you look at the number 1,600, and some have said that it may go as high as 1,700. Well, if you look at the entire state, and even in the larger metro areas, that's probably going to break down to maybe 40 or 50 more people coming back into that area than normally does in a month. But what also has happened is through this legislation, the Department of Corrections has the resources also to make sure that the probation and parole officers are being given a large amount of professional development that helps them become more of, and I heard someone put it really well, they're moving away from being the warrior to the guardian.
Is there anything particular in their training can you go into a little more detail about that?
We also know that in this day and age, with reentry programming, it is going to be evidence-based and data-driven programs that we're using. That then brings in an area of what we call cognitive behavior therapy, which is basically changing the criminal mindset and helping them understand that this is a better way to live our lives. For me, with Right on Crime, we are so laser focused on public safety. And if we did not believe as an organization, as large as we are, that this was really beneficial to the community and the citizens of the state, we wouldn't be backing it either. But we have seen it work. This is what we're doing. We're taking those evidence-based programs and providing them to these individuals so that they can learn how to actually live in a different way.
So it's obviously important that we have these reforms for a personal level, but also if you're looking at state level policy, why is it important?
Well, we know that right now in the state, it costs $24,000 a year to keep someone incarcerated. So if we would start focusing our prison space on the truly violent offenders that need to be doing time and find alternative ways to let those that probably are not a high risk for continuing crime, if they're given these reentry life skills programs, and get them out of the prisons, then we're saving money. This particular package of bills, once everything is implemented over the next 10 years, we're going to lower the prison population by 10%, and the state is going to be saving over $358 million.
I'd also like to ask if there are any other reform measures that weren't passed last session that Right on Crime would like to see implemented in the future.
You know, we really were very happy with the way the package came together. You have to remember that this was a bipartisan effort, and that is something that I think was just phenomenal for the state. I mean, with Louisiana having been for decades the #1 incarcerator in the world in locking up our citizens, then to have had both sides, the right and the left, coming together with a Democratic governor and mainly a Republican legislature, that was a major feat. And I think what it shows is how much support there was for us to no longer be the #1 incarcerator. When we look at how the implementation actually comes out, we may want to say, hey, maybe we need to tweak this a little bit, maybe we need to add this, but I think we're still waiting because we know the process works, so we're waiting for that process to be able to be carried out. One of the things I find out is that when individuals get engaged in reentry programs, that it does make a major difference. And I think we're going to see a lot of them come out and be able to become, as we've always said, to move from a tax burden to a taxpayer. And that's what we want to see too. So that's really what this is all about, and I think we need to wait and let the process work because it has worked in so many other places.
All right, well, thank you very much for joining us.
You're quite welcome.
These reforms are modeled after similar measures in other southern states. Texas, for example, implemented a similar policy in 2007 and has seen their incarceration rate drop 16% and the crime rate drop 30%.
All right, Kelly, thank you. Always interesting. Appreciate it.
Thanks.
The AIDS Healthcare Foundation has spent $115,000 in TV attack ads against Baton Rouge Mayor Sharon Weston Broome. The commercials claim she cut HIV/AIDS funding for a nonprofit group that runs 2 clinics in Baton Rouge. The group filed a lawsuit against the city parish, alleging it was unfair for the mayor's office to drop a contract in which they would have shared federal grant money. Mayor Broome told me the group wouldn't comply with grant writing requirements and was not eligible to get the money.
So no way have we cut funding, in no way. In fact, we just recently got additional funding from the Ryan White Foundation. Our monies now are about $4.6 million that are flowing through city parish government. And just to show you our commitment to addressing HIV and AIDS, the Mayor's Healthy City Initiative is in the process of collaboratively planning with providers in the area a summit focused on HIV and AIDS.
Now, information about the HIV summit will be forthcoming. The first moment we hear about it, we'll let you know. Louisiana should be taking every possible action that they can against the disease. We rank second in the nation in HIV rates. Louisiana Public Square examined the many HIV/AIDS challenges from our bigger cities to those cities not so big.
What we're not doing is we're not effectively getting the message out to the primary target group that we should be, men who have sex with men, and they need to take responsibility for their own behavior. Still, half of all of our new infections are among that group, and they need to protect themselves, their partners, particularly their female partners, and they can do that by the new PrEP protocol, pre-exposure prophylaxis. I can't say that often enough. 1 pill once a day of Truvada will prevent someone from acquiring HIV infection.
There's a large number of African American women that are living with HIV and are newly diagnosed each year. There's been an emphasis on men who have sex with men, and I think that when you look at the number of women, African American women living with HIV and the newly diagnosed women each year, there should be some emphasis that's geared towards African American women.
We know what interventions work. We can look at evidence-based interventions. We know what to do. We know what zip codes we need to be in. How do we get the money to follow the work?
And Kim, for years, the state would have a $2.5 million match to supplement the prevention monies that they got from the CDC. And we saw in the General's administration that $2.5 million match went away. And the state, and I don't mean the state, the programs or the programmatic side of it, but our legislators, they have to make a real conscious effort to putting a line item back in our general budget to address HIV. Because Ms. Nash, you brought up the question about the CDC funds and it being cut. I don't think those CDC funds come back. So I think the state has to just speak in real terms and start to address this locally, knowing that those federal dollars just won't ever reappear.
I can't share enough how grateful I am to be in a state where Medicaid has been expanded, because people have access to care. We are very fortunate with our staff that we have someone who, that's what she does, is that she helps to navigate that process for them so that they can get coverage and they can get the things that they need so that they can afford antiretroviral therapy and they can become virally suppressed. I am very afraid of what may happen, particularly because I'm in the rural area, that if for some reason we don't have Medicaid anymore, or for some reason some political agenda makes that be a barrier, what's going to really happen. And so while I want to be optimistic about the 3-year thing and hopefully we'll get some ground moving, If we lose what we currently have, we're going to be in big trouble.
Really, what I think for PrEP to be more mainstream and to get to the youth, I think PrEP needs to be in primary care. So youth are seeing their family doctors, their pediatricians. Most of them don't think to come to an infectious disease clinic. Most people don't actually think they're at risk even when they are. So I really would like to see more knowledge in primary care providers and the option for youth to get this medication closer to home with somebody they already know and trust.
We as a community need to just come together and work together because we're all trying to reach the same goal, and that's to lower the rates of HIV in our state. Our department focuses on youth age 12 to 19. We have some interesting grants that are going on right now with the ART. We have a request for applications on our website. You could visit us at gov.louisiana.gov and click on the Life tab, and we have different opportunities for parental involvement, for our abstinence centric education. And we talk about abstinence, and we define it broadly as the refraining from doing anything that will impair a decision or something that will cause an unintended or unwanted outcome.
Obviously, I'm not a school teacher, but I feel like when we focus our sexual education on abstinence, we're missing a lot of opportunity to teach our kids the important things that they need to know. I mean, we teach our kids how to exercise so they don't get heart disease when they're 50, but somehow we expect them to be abstinent over a lifetime. It's extremely unlikely. So kids need to know the basics of reproduction, and you know, people come to clinic with diagnoses that they had no idea that they were at risk for, and that's, you know, I would rather somebody be educated and make a decision that maybe has a bad outcome versus just do something and end up with that outcome without having any choice about it.
HIV/AIDS in Louisiana repeats on LPB this Sunday at 11 a.m. and it's viewable online right now at lpb.org/publicsquare. For more information on PrEP, click on the Prep Me link at louisianahealthhub.org. On Tuesday this week, New Orleans and the world, really, lost a legendary rhythm and blues singer who became one of the biggest stars of the early rock and roll era. Fats Domino died at the home of one of his children in Harvey. Harvey is across the Mississippi River and the Big Easy, the city where Fats Domino was born.
I'll be your little boy, you be my little girl. We go round and round, round and round the world.
Though he stood only 5'5", his talent knew no limit. Among his accolades, more than 36 top 40 pop hits. Things like Blueberry Hill, I'm Walkin', Blue Monday, and Walkin' to New Orleans. He sold 65 million records, second only to Elvis Presley.
I remember when I was a kid, that was there was, Shake, Rattle, and Roll was around that time. It was the beginning, it was like 52, 53 when I first started hearing that stuff. And he was right there, one after the other, boom, 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 boom.
And he had hit after hit after hit. Sometimes he would have one of his songs #1 in the country and the other side #3, and the recording that was out before the recent record was #4, and the other side of that was #5.
By 2005, the youngest of 8 children was just where he wanted to be, at home in New Orleans, far removed from the screaming crowds and acclaim. But he was also right in the path of Hurricane Katrina, and he refused to leave, staying put with his wife and some children. In the chaos that followed and that world in panic, word spread that floodwaters had carried him away to his death. In truth, he was still holed up in his 9th Ward home. When the water inside reached 15 feet, he and his family were airlifted from the 3rd floor to refuge in the Superdome. Amid all that went on there, with no power and no plumbing, Domino still took it in stride. The high water destroyed his grand piano and even carried away many of his 24 gold records. But to the joy of millions, it could not carry him away. About his premature demise, he recorded a song and played it in a 2006 charity concert that raised money for New Orleans musicians. The title said it all.
I'm alive and kicking. I'm alive and kicking. I'm alive and kicking. And I'm where I want to be.
Still alive and kicking, the resilient Fats Domino kept on doing what he enjoyed. I just drink my little beers, do some cooking, anything I feel like. In 1957, a reporter asked him, "Fats, how did this rock and roll get started anyway?" He answered, "Well, what they call rock and roll now is rhythm and blues. I've been playing it for 15 years in New Orleans." The legendary Fats Domino was 89. Now, back in 2007, LPB, along with our sister station, WLAE, produced Fats Domino's final live concert. It was great to see him on stage performing before a large audience at Tipitina's one last time. And this programming note, Fats Domino American Masters, will air at 9:30 p.m. on Tuesday, October 31st on LPB. And that is our show for this week. Remember, you can watch LPB on demand on your phone or tablet with our LPB Anywhere app. The download's free from your app store. You can catch LPB news and public affairs shows, as well as other Louisiana programs that you've come to enjoy over the years. And please like us on Facebook as well. For everyone at Louisiana Public Broadcasting, I'm Andre Morrow. Thanks for watching. Until next time, that's the state we're in.
Check us out on Facebook and Twitter, and visit lpb.org, where you can view more stories and leave us a comment. This program is available on DVD. Support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum. Located in Jennings City Hall, the museum focuses on emerging Louisiana artists and is a historical and cultural center for Southwest Louisiana. Additional support provided by the Foundation for Excellence in Louisiana Public Broadcasting and viewers like you.